Hi, in this video I'd like to talk about cervical polyps, its cause and also treatment here at Antai Hospital. So cervical polyps are really just excessive skin strips. They can be either greyish or pinkish, thin stem-like growths that can protrude from the cervical canal. They can either be growing on the outer layers of the cervix or from the inner layer growing towards the outer surface. These are called cervical polyps. Now we don't exactly know what causes it, but we do highly suspect that it is HPV infection that is causing it. Majority cases of cervical polyps are actually caused by it's a viral infection of HPV. Although there are other lesser known causes, for example, some chronic inflammation of your cervix. There could be a rupture of certain blood vessels in the cervix, causing this polyp to grow out in the process of recovery. So cervical polyps, although they do not usually present any symptoms, but if there are any symptoms, the most distinct one is that we would experience abnormal bleeding. So these types of bleeding can happen during sexual intercourse or even after your menses is already clean, but you still experience bleeding in between your previous menses and your next menses. Furthermore, you will also have a foul-smelling vaginal discharge. This all can be a case of cervical polyps. So upon diagnosis using a speculum, so we can have visual confirmation of the presence of this cervical polyps, we will need to do a biopsy. So we will need to take a tissue sample, and it can almost be guaranteed that the cause is due to HPV infection. We cannot confirm which exact strains lead to the cervical polyps. So first of all, you need to make sure that you are already vaccinated to prevent the growth of these cervical polyps. If you have not been vaccinated and been diagnosed with cervical polyps, here at Antai Hospital, how we treat this condition is that first of all, we need to surgically remove this polyp using hysteroscopy. Sometimes we need to use 3D laparoscopy as well. So once this polyp is removed, most hospitals will already stop here. Then they will end the surgery. And then in a few months, you will realize that your cervical polyps relapses, it recurs, grows back even much more severe than your previous one. This is because the root cause is not being dealt with. The HPV infection here has not been treated. So here at Antai Hospital, after removing this polyp, we will need to apply our Antai, which is our proprietary HPV medication that can actually kill the infected cells in the cervical canal, causing the new cells beneath the cells that are removed to replenish so that this HPV infection can actually be eliminated. So your HPV positive diagnosis will in fact turn into HPV negative. Once you achieve this with our treatment, then cervical polyps will actually never come back again unless you get reinfected once more. So we recommend after the polyps are removed, HPV negative has been confirmed with our treatment, then you should go for a HPV vaccination to have a much more secure chance of these cervical polyps ever coming back. So we offer a full contractual treatment for these types of treatment here at Antai Hospital. If you do not turn HPV negative with receiving our treatment, then we offer a full refund guarantee. Please get in touch with us today.